Hello, everyone. Thank you so much for attending and coming to IRM Qatar Chapter first ever webinar. My name is Hatem Safty. I'm actually the chairman of the Institute of Risk Management, the Qatar Chapter, and I'm really honored to be hosting our first webinar on such an important topic that everybody is talking about these days. It's actually the first time IRM Qatar to do a webinar, rather normal, different than our normal gathering and sessions that we do. And actually, it's really couldn't be a better timing to manage the risk of such times that we're living in, and we're not going to be helping spreading the virus by gathering in one place. I personally believe that COVID-19 is actually going to, and the current pandemic has been announced by the World Health Organization, is going to change everything. There will be time, what was before the COVID-19 and what was after the COVID-19. It will be, it will change us economically, culturally, politically, the way we do business. A lot of people now are going and working from home and learning how to work from home. So a lot of things will change after this event. Without further ado, let me introduce to you guys our facilitator, Mr. Aarnout Wennekers. He's actually a corporate planning manager at Qatar Free Zones Authority. He's a trusted board and corporate governance advisor, leadership, and coach. He's the former advisor to the former chairman and president of Qatar Petroleum. Mr. Arn, the mic is yours.
There we go. Can you hear me now?
Yes.
Yes, we can.
Excellent. Thank you for that introduction, Hatem, and welcome to this IRM Qatar Chapter webinar on pandemic planning. I'd like to first introduce our panelists to you. So first, I'd like to go with the president of Baldwin Global Risk Services Limited. Sorry, I'm getting a lot of feedback. Is anyone else hearing that?
Yes.
Or am I clear? You are? Okay. All right, well, I'll continue, and please bear with me. So Mr. Larsen has over 18 years of experience. He holds a degree in risk management from Glasgow Caledonian University and is a certified fellow of the IRM. In October 2017, Alex was awarded Risk Manager of the Year for the Middle East and Africa by a panel of risk experts on behalf of Strategic Risk and Global Reinsurance magazines. His expertise covers all aspects of enterprise risk management and business continuity, and he has worked in challenging environments such as Iraq. And I'm actually happy and pleased to follow my friend. Then I'd like to introduce Mr. Giroux, Dufort, MIRM. Ghislain is a president of Baldwin Global Risk Strategies Incorporated. He has over 25 years of experience. He's a graduate of the Financial Times Non-Executive Director Diploma, MBA from McGill University, and an MSc in Applied Mathematics and a BSc in Physics from the University of Montreal. His expertise is in enterprise risk management, and it also extends to developing pandemic and business continuity plans. Experience during the H1N1 crisis, where he helped a multinational manufacturer implement the H1N1 risk management and business continuity capability. Then we have Mr. Dylan Campbell. Sorry guys, I'm getting such bad feedback. So he's a chemical engineer with a master's degree in safety, risk, and reliability engineering. Dylan has over 15 years of experience and is currently working at, I'm just having a technical difficulty with seeing the screen. So sorry. So Dylan I've known Dylan for the last couple of years. He's involved in the IRM Qatar chapter, and he's currently working on pandemic planning at his employer. He also has a family of young children, and he resides currently in Qatar. Sorry, guys, I can't see it. So what I'd like to do is start off the moderated panel, first asking Alex Larsen if he could answer the question regarding classification and reporting of pandemic risk. Especially before we know about it, and such as a black swan and an emerging risk.
I'm sorry, Arn. I believe as a agenda of the day, Ghislain was going to start by giving us a very quick introduction to pandemic planning. So I'd like to hand over to Ghislain.
Please, sorry, my apologies. Thank you. I'm looking at the wrong agenda part. Sorry about that.
Thank you. Can everyone hear me correctly?
Yes.
Can you hear me? Good.
Yes, we can.
Should I take control of the screen?
Please.
Let me see. Thank you.
Ghislain, now you are a presenter now. For the other
Thank you very much.
Because we still have some echo, until we start the panel discussion, would you please mute yourself so we have only Ghislain speaking at the moment?
Thank you very much. Can you all see the slides? Hello, can you all see the slides?
Yes.
Thank you. So thank you very much for the introduction. Yes, this will be a presentation on pandemic risk management, both prevention and how to deal with it in a business continuity fashion. The first slide I would like to show you, if I can have it to move here. Yes, what are the key characteristics of this virus? This is taken from a number of sources, the World Health Organization, the CDC, and Health Canada. It's a flu-like virus, so the symptoms are very similar to the flu: fever, cough, difficulty breathing. You become highly contagious at the very beginning of the symptoms appearing, so that is part of the challenges here. You can catch it through air and surfaces. It will not stick in the air for long like the measles, which attaches to dust particles. It will only stay in the air as long as the droplets of bodily fluid carry it. And on surfaces, we think up to 24 hours on cardboard and up to 3 days on hard surfaces such as steel and glass. So that is a challenge here, of course, in terms of keeping clean surfaces that are shared with people. The incubation period ranges from 2 to 12 days. We say 14 days for quarantine purposes to allow for a 2-day buffer. The average rate is 5 days incubation. The impact ranges from very, very mild symptoms for the young, and the young here means from early childhood to 50 years old, and more severe for the older people. The rate so far seems to be 8% for 7 years and older, and 15% for 8 years and older. So at risk are those older adults, and also people of any age who suffer from other diseases such as heart diseases, diabetes, lung diseases. Finally, on the risk aspect, again, the very concerning thing is there's no immunization in the population right now. There is no vaccine available and no treatment. So this is the situation in terms of the risk characteristics of this virus. This page shows you the WHO's tracking. This is from 3 days ago, so you could go to their site and see what's happening right now. They track the cases around the world, the number of cases confirmed that have been tested, the mortality of those cases, and the number of countries that have been affected. As you know, the most affected countries are China, Italy, and so on, and it changes, of course, every day. So we have to monitor this on a regular basis. This next slide provides you with basic risk management questions to consider in your company and organization. To the left are the key risks. So first of all, of course, your employees may get infected and may infect others, be they fellow employees, clients, suppliers, partners. And to mitigate that, of course, is personal hygiene that you can facilitate at your company. One thing that, again, keep in mind, and these slides will be available later on the IRM website, so I won't go through everything. You can refer to it later on. I would just like to highlight a few key points. There is no vaccination at this point, and the masks are not really useful except if they're N95 masks, which should be reserved for healthcare professionals. If you get ill, the second risk down the column to the left, you may, again, have very mild symptoms, but mostly older people may have severe symptoms and die. There is no treatment for that, so you have to stay home and seek medical help by phone first. The only thing that can help people with these severe symptoms is to be put on ventilators in a hospital. So the limitation here is the number of ventilators in hospital and the number of rooms in hospital that can accommodate a surge of such heavily impacted people. The third risk down the line is what we deal most here is losing business. So all the issue of business continuity and how to manage this risk from an organization and company point of view, and we'll deal with that in the next slide. Finally, I put down the last risk, which is the risk of litigation. This situation involves the right of people, laws and regulation that may change over time. So you have to make sure you comply with the laws and regulation that apply to your business. Whether you're one country or a multinational business, you will have to take that into account and communicate reliable information to your employees, clients, suppliers, partners, possibly if your intranet, your website, letters, or you may even consider instituting a 1-800 line to inform people of your actions and your status regarding this. The final box in the middle is KRIs and KPIs you may want to consider to track your situation relative to this risk, and also maybe relative to other companies that you're dealing with or in competition with you. Infection rates, rate of absenteeism, rate of mortality, loss of revenue and profits relative to your peers. On the next slide, this is a framework that we use at Baldwin Global to assess exposure to risks. It applies to any type of organization, company, and any kind of risk. Here, of course, we're concerned with COVID-19 risk exposure and its implications for business continuity. In the middle is your company. To the left is your supply chain. To the right is your clients, your consumers, and people you are potentially rendering services or delivering products to. And you are embedded in a competitive environment with competitors, existing competitors, new entrants, potentially, and your partners and counterparties to which you may transfer risks or receive risks from. In any situation, there is usually an upside potential for any risk. It may seem strange to think about that. COVID-19 will obviously negatively affect every company. That's the top box in red, negative risks. But some sectors or industries may benefit from this. I've listed medical supplies, pharmaceutical companies, telecommunication with remote work being implemented, internet providers, home delivery. Yesterday, Amazon announced that it was hiring 100,000 people to help with their warehousing because of increased requests for home delivery. And of course, home entertainment, cinema, being closed, there will be more people wanting to entertain themselves at home. To the right are the key risk factors specifically to keep in mind in this situation with the COVID-19 and continuity issues for your company. The criticality of your business processes and the entities you are dealing with, be they your suppliers, of course, partners, clients, this needs to be prioritized, taking into account the human presence dependency of those either processes or entities. The more your process requires human interaction at close distance, people working together in a factory, for instance, the more at risk you will be. So you need to consider what are your backup alternatives. Do you have any versatility within your workforce for people replacing others as they may get sick and may have to leave your premises? Any remote potential, doing work from home, if at all possible. IT network capabilities will become an issue because I think some of you know that there are already services that have reached the limit or have crashed because of the increased demand for remote work support infrastructure. Following the COVID-19 evolution, it moves every day, every hour, and it may have impacts on transportation. We all know that airlines have been progressively shut down. They may shut down entirely, but what about the delivery of products? Will shipping be the next big risk item on the horizon? You may consider that cargo ships have crews on board that are always in close proximity for a number of weeks on the oceans. When will one case happen where an entire crew is being contaminated by COVID-19, and what will be the implications on shipping? This is something I think we should keep in mind. And finally, government action and legislation is changing constantly. 2 days ago, the mayor of New York said he was closing all schools, all public schools, and they may not reopen for this year. And he thought that the crisis would be with us for at least 6 months. So this is something to keep in mind as you're developing your business continuity scenarios. On the next slide is a proposed sample action plan to implement as quickly as possible or adjust your existing continuity plans as quickly as possible. I will not go through all the steps because, as I say, you will be able to refer to it later on. If you have questions on specific points afterwards, of course, we'd be glad to answer that as a panel. But the first stage is to basically start requiring plans from your suppliers. They are in the same situation as you, and your suppliers depend on how they handle the situation. So this is the first point, together with appointing your own coordinators within your company who will be the point persons to go to understand what the situation at your various business units. And then you prepare your strategy for communicating with clients, employees, and so on. Stage 2 is to consider realistic scenarios and credible worst-case scenarios. During the time of H1N1 in 2009, we considered absenteeisms of 20%, 40% for 8 weeks, with a peak of 50% people missing on site for a week. That seemed like a very difficult situation at the time. Unfortunately, it now looks like an easy situation given the COVID-19 situation. COVID-19 may contaminate people exponentially if left unchecked, which is very different from the H1N1 situation. So you have to find a realistic scenario in case things go not too bad, but also a credible worst case scenario. And then you review your plans and update them. And in stage 3, you would implement your plans and exercise them, monitor the situation with KRIs you may have developed, and continually monitor and inform your employees and all your stakeholders, suppliers, partners, clients, and of course, your shareholders if you are a shareholding company. On the next page, I would just like to mention 2 things. If you already have a plan or a business continuity software or platform, of course, you can update it, and that would be the best scenario. If you do not have already something in place, there probably isn't enough time to start doing an RFP to require vendors to provide you with a software. If you have time, fine, but you may want to consider then Excel-based plans that are easily understood by everyone within the company and that can be designed in a uniform manner so that when you receive those plans, you can consolidate them easily. And the reason for using Excel is that it has ease of implementation, ease of sorting, sorting capabilities, calculation, functions. So that might be the best bet if you want to implement quickly something that will work. I've listed the key sections you would find in any typical business continuity plan. I would like to highlight number 8 in this case. You will consolidate a lot of information from employees, clients, suppliers, partners, and so on, which will contain personal information like their coordinates at home, how to reach them. Keep in mind that your country may have a privacy of information requirements that have to be followed. So that will be a challenge also to mix practicality and convenience with the need to preserve personal information. And unfortunately, there are always people who will try to take advantage of a situation like this one. So hackers will probably try to benefit from the fact that companies are going more remote with less security probably on their IT network and equipment. So keep that in mind also. Key risk indicators monitoring. This is taken from 2009 during the H1N1 outbreak. Some companies were following this kind of information. This is taken from the US. The reason is that the US has a very large population with very, very well-structured information gathering and reporting through the CDC. And so this was reporting every week the status of infections. And in this particular chart, the percentage mortality due to pneumonia and influenza. And as you see, there was a cyclicality to it. And the baseline at the bottom is the seasonal flu mortality rate. And the other continuous line at the top, following very closely, is the epidemic threshold considered by the CDC. And the red line was the actual rate of mortality found in hospitals and medical centers in the US week by week. And of course, now we see the result over, here in this case, a number of a year. We see now that it never exceeded too badly the seasonal fluctuations. But when you're monitoring it day to day, week to week, you don't know if a peak like the one at the middle in 2008 was going to continue upwards or go back to normal. And this is the situation we're facing now. We don't know if the measures taken by various governments will limit the spread of the infection and its mortality rate or not. So that's to be followed. And your organization should find the proper key risk indicators to monitor to be able to factor this into your planning for business continuity. This slide provides the categorization of the CDC of pandemic risk, categories 1 to 5. I would like to highlight 2 key metrics here. To the left is the case fatality ratio. Case fatality ratio is basically the percentage of people who are infected, who have been diagnosed, and who die from it. You see that the worst case scenario is higher than 2% of people infected dying from it. And to the right, or the bottom of the chart to the right, is the illness rate. This is the percent of the population that is infected by a virus. So on this chart to the right, you see the various past flu pandemics. The worst one being the 1918 Spanish flu to the top line, which intersects at the bottom with the illness rate of 30%. So 30% of the population got the 1918 Spanish flu, and about between 2 and 2.5% of those infected died from it. And if you use that scenario and various other scenarios, you can project, for instance, in the US, but you could do it for any country, based on a 300 million US population. If a 1918 scenario was to occur now, you would project 1.8 million deaths in the US. So this will have to be followed and monitored to see in which category we may be with this COVID-19 pandemic. On the next slide is an explanation why people have shut down their entire country For instance, Italy, to the left at the top, you see if you apply the 1918 scenario to a 60 million population like Italy is, a 30% illness rate times a 2.5% case fatality ratio, this requires 450,000 hospitalizations. When you consider that China built 2 hospitals in a week, which could accommodate 2,500 people, at a single 2,500 people hospital, you would require 40 of those hospitals to accommodate such an influx of people requiring ventilators in hospitals. So this brings us to a question. The restrictions to movement has been used to what we call flatten the curve. So if you look at the solid purple curve, this is the outbreak evolution without any restrictions. And what authorities are trying to do by limiting movement and confining people to their home is to flatten the rate of influx of people getting sick to hospitals, because hospitals are the weakest link here in this chain. Unless you let people die in the street, Italy, the reason why they shut down their country is that they were facing choices such as, do I remove the ventilator from this individual to give it to this individual who might be younger and have more chances of surviving this outbreak. To avoid those kind of hard decisions, countries have decided to limit movement so that the capacity of hospitals is not overflown. However, 2 questions arise from this approach. The first one is how many months or years before everyone will get immunized through exposure or before a vaccine is developed and distributed. Estimates typically are that the vaccine will take about 12 to 18 months to become available. So you can imagine we're talking about a year to a year and a half home. Modeling of the epidemics, I've seen some models yesterday, and they say that to get everybody immunized through gradual exposure by letting people getting in and out of homes from time to time without overflowing hospitals will require at least 2 years. So this is the situation we're facing. And the other question is, what if it evolves? Because COVID-19 is a coronavirus. It is similar to seasonal flu, as I understand it. And we know that seasonal flu changes every year and that vaccination have to be changed and they're not entirely effective. So this is a totally different world that we may be living in. And Hatem mentioned in his introduction, maybe this will change for a substantial time the way we operate and live in society. I would like to have on some perspective. First here, and I'll end with I hope a more positive note on the other slide. This is from the World Health Organization, the causes of death among the 60 to 69 years old to the left and the 70 plus years old. So those are the people most at risk from this outbreak. But you can see that they have also other concerns. Their major causes of death are heart disease, strokes, pulmonary disease, diabetes, and so on. And I was hearing yesterday that medical experts are a bit concerned that with overflowing hospitals with COVID-19 cases, we will have to postpone some other treatments, including heart disease, strokes, and so on. So that may also be an issue to consider as a society. How much weight do we want to give to COVID-19 relative to other illnesses? I was trying to end on a positive note. This is the last slide of this presentation. There are different approaches being taken by different countries. China, as you know, sequestered an entire province, but not the entire country. South Korea has a very different approach. They test heavily. They're testing more than any other country. So they provide us with an interesting base of information regarding the illness rate, the percent of the population that is infected. So that's going to be very important. And they selectively quarantine people who have been identified as carrying the virus. Italy has shut down its entire country. The UK, until I think yesterday, had an approach of mass immunization, basically saying we will protect the most at risk, the 60, 70 years old plus will stay at home, and we will let the other ones go with their daily lives so that they will get exposed to the virus and immunization will increase. However, I think they're starting to change their approach. Yesterday, we've heard that they were to limit public gatherings at pubs and so on. And the United States, because of its size and quality of information, is usually a good source of information to follow, to infer information for your own organization. Even if you're in a different country, the virus does not know borders or countries, so it will behave the same way. The only difference is, of course, the infrastructure available to treat it and to accommodate patients. I was saying I was to end on a positive note, and the note is this. It's interesting that when you consider other kinds of risks, for instance, climate change had been in the news for many, many years and months and was the primary risk everybody was focusing on. And this risk happened and suddenly confines people to home. It's interesting to note that this situation was maybe the way to get people to reduce some of the greenhouse gases emissions, one associated with transportation. Who knows, maybe if we stay home in the future, we will reduce our gas emissions and will contribute to better managing climate change risk. Maybe for the wrong reasons, but it might be something to consider and to keep as a practice in the future. So that is one, I hope, positive note that we may draw from this situation. And of course, we would be glad to hear your question after the panel discussion. We already have some questions that we'd like answered, and as we go along, we'll be pleased to answer others that we may have. Thank you very much.
Ghislain, thank you so much for such informative short presentation. I'd like it to be going longer if we can. So I'll pass again back to Arn, our facilitator, to start asking our panelists question. Just for everybody to know, please use the question buttons that you have in your webinar to start asking the panelists questions, and I'll be responsible for gathering these questions and passing it to the panelists. So please make sure you're using the questions and asking everybody. Arn, back to you.
Thank you, Hatem. And Ghislain, thank you so very much for ending your presentation on such a positive note, because I think it is rather gloomy and doomy at the moment, and I think it does portend well for what kind of action we can take in the future. And again, thank you so much for your presentation. It was very informative. Now, what I'd like to do is start on the at the appropriate time, the questions to the panelists. So first, I'd like to start with Alexander. In terms of prior to a pandemic, in terms of classification and reporting of pandemic risk, before we know about it, and once the incident has been recorded, can you perhaps focus on that a bit and give us your views on that?
Yeah, absolutely. A lot of people are obviously talking online, and I've had the question a few times about, well, is it a black swan event? Is it an emerging risk? What is it? Is it a corporate risk? And for me, I never like putting things into specific classifications. I don't really care where it sits as long as we're talking about it. But just to give an indication, I think for a lot of organizations, this is a corporate risk that needs to be on the corporate risk register at all times. They need to have it as part of their ongoing business concerns, whether you're, for example, an airline, a holiday company, anyone that basically knows they could be affected by such a risk, pandemic, virus. It doesn't even need to be a pandemic. It can be an epidemic or just a virus that comes as a sickness within the airline or whatever. So some organizations will want to have that as a corporate risk at all times. I think the question is, when it comes to emerging risk, I think it absolutely is an emerging risk, but not in the sense that, oh, is pandemic an emerging risk? More from the point of view that, is this happening more often? Will it happen more often? We know that we are a growing population on Earth. We know that there are problems. We know that people are trading a lot more. We're an interconnected globe now where people are traveling very easily, and that's supposed to be getting much faster with Elon Musk's plans of being able to travel from America to Saudi Arabia in the space of like an hour and a half, for example, he was saying, or to Australia in 3 hours. What happens when we start being able to travel so frequently and so easily? So the emerging risk, in my view, is more a case of this is happening more often, and we need to see this in the future and be prepared for this. The black swan event, I'm not a big fan of. A black swan really has to be an unexpected, rare event. It should be very difficult to foresee it. And for me, this was foreseeable. The last few years, people have been warning about this. They've been not just a warning like, oh, the economy is going to crash, oh, there's going to be a pandemic. Yeah, that's fair enough. But they actually had facts to back it up. Scientists have been saying it. They've got simulations that show it. They even know geographically where to expect it to start and how it will spread. So I don't see it as a black swan event, the virus itself. What I see as a black swan event, perhaps, is the virus occurring, the oil prices crashing because of all the things that are going on with Russia and Saudi Arabia. And for example, the economies crashing as a result, especially with the unprecedented closures that we're seeing across Europe. I don't think many people would have expected to see that kind of action. So I think all these events together are perhaps what you might want to call a black swan. You could call them gray rhinos. That's the term a lot of people call them. When gray rhinos occur, when they crash, and funnily enough, rhinos, actually a group of rhinos tend to be called a crash. But when they crash, they become the black swan event. But gray rhinos are essentially possible to predict. I think the black swan event is an easy way to sort of get out of saying we didn't know, we couldn't expect it. So my biggest issue though is I don't care how you classify it, let's just talk about it. Let's build scenarios, let's talk a bit about it at the top levels and let's plan for it.
Like, so one question, just as a follow-up, you're saying plan for it, but given the fact that many companies are running on such thin margins, how realistically do you see that happening?
Well, you know, that's an interesting point, and I hope the rest of the panel can discuss this as well. I think there's a difference when you are forced into that situation of having very small margins. But a lot of organizations have larger margins, and they choose, it goes back to this, how much money are we willing to spend, leaving us with next to nothing left over. I think if we are doing risk management properly, linking it to our objectives, understanding what our objectives are, we can do cost risk analysis and so forth, and we can actually look at, well, how much contingency do we need to decide in the case of risks occurring, and being able to either take advantage of the situation because we're prepared and we have a nice amount of funds behind us, or that we can actually survive, or that we're able to keep our staff and be able to keep them, you know, on our payroll so that they don't suffer, and we build up our reputation as a result of being a good employer and so forth. So I think it's a difficult question from the point of view that some organizations are forced into those small margins, but all the more reason to plan for such an event. If you have small margins, you know you're more at risk. So you should be absolutely looking at these scenarios and what ifs, and do we have the plan in place? If oil price falls, what are we going to do? Some organizations might say, buy. We need to buy more equipment so that when it goes back up, we're ready for projects. It's the same idea in a pandemic. Are we prepared? Is there anything we can do? For example, I know that some organizations, Louis Vuitton, for example, decided to move into, instead of making perfumes, they're now making hand sanitizers. And they're actually handing it out to the French, I think, government to hand out. So they've actually, A, done something good for society, it's good for their reputation. B, it's given them an excuse to remain open rather than making their perfumes and it's not selling. They're now at least making hand sanitizers, helping the society. Now, I don't think that was an overnight decision. I might be wrong. I think they probably have some sort of plans around that kind of thing to be able to move so quickly?
If I may add to that, Alexander, I just heard that I think the UK has asked companies like Rolls-Royce to switch to producing medical equipment. And France is considering the situation as a war against the virus. So you may see, as you described, a change of industries to know the necessities that are required now to battle this outbreak.
Absolutely, and I think it's not necessarily just having a plan. I'm talking a lot about plans, but it might even just be conceptually and having leadership and a risk team that are dynamic and resilient, an organization that's resilient with the right culture to take risk during a situation, being able to adapt.
Excellent, thank you. Dylan, would you like to add anything?
I think Alex has said it all. I've enjoyed the explanation. I did have a little bit of a chuckle to myself because personally was assisting the company updated strategic risk profile when this pandemic came along. I'll be honest and say, it probably wasn't one of our top priorities. So, again, I think it's just trying to keep a wider perspective. When you're looking at your organization and you're trying to understand the things that might impact the business. So I think like many ERM practitioners and risk managers, this is a major learning point.
And can I also just add one more thing, and this goes to Hatem and the Institute of Risk Management, Qatar Regional Group. About a month ago, they had set up this as a physical session. Literally a few days later, the decision was taken that we don't know, but there is a risk that this scenario might happen, that we can't travel and so forth. Especially we've got someone in Canada, we've got myself, I'm in the UK at the moment. What if it doesn't go ahead? And we started looking well ahead of time and thought, why don't we just make it a webinar? And then a week ago, when we realized it was the right decision and it should be the webinar, here we are. And we've actually been able to take it further than the Qatar group, and it's gone out to international. So that's a big well done to the IRM Qatar Regional Group committee and team. So hats off to you.
Thank you, Alex. And actually, as I said before, COVID is going to change everything. And since we managed to manage our own risk by changing it into webinar, somehow it's actually extending to more people. So normally we have like 20 to 30 people attending our seminar. Because we're doing it through webinar, we have more than 112 attendees. So you may look into it like, what is the positive side as well? Because we are sharing knowledge with more people now using technology.
Yes, I think COVID-19 is going to have a profound impact on the way that we consider work and how we add value. Now, what I'd like to do is turn our attention to the panelists' attention to the topic of preparing for a pandemic. And what I would like to start, and I'll pose this question to Ghislain first, in terms of the pandemic plan, what are the key aspects of a plan that a business or an organization should take into account?
Thank you. Typically, businesses should have plans all the time for any reason that may occur. Business continuity's philosophy is that things that are unforeseen may happen, and you have to be ready to react, recover from it, and be able to service your priority clients and eventually all your services and products to all your clients in a given time period. And you do not necessarily consider all the possibilities, but of course you will focus on a few key credible risks that may occur. If you're in an earthquake zone, of course you will consider the risk of earthquakes interrupting your business. If you're in near an airport, you may consider an airplane crash. But you have to be ready for anything. Of course, as Alexander said, a pandemic had been forecast for many, many years, if not decades. We just don't know when it will occur and how bad it will be and what its profile will be. One thing I hadn't mentioned that was also a positive side to this current outbreak we have, of course, to get the data. It's very important to base decisions on credible data. But so far, we know that this pandemic affects people of 70 years old and more. Sometimes, as you saw in my presentation, we look at the worst case scenarios being the 1918 Spanish flu. And one of the arguments being used to prevent public gatherings is to use the example of Philadelphia versus Chicago and other cities in the US. They had all parades planned at about the same time, and all of them canceled their parades except Philadelphia, which went ahead with its parade. And Philadelphia was the worst hit in the US in terms of hospitalization after that. So we're using this as an example to limit public gatherings. However, one question that we may have is consider the impact that the 1918 scenario had. It was impacting mostly people from 15 to 44 years old. It's totally different from today's pandemic, which affects people of 7 years plus. This means that you could, in theory, find a solution where you would protect those 7-year-old people by asking them to stay home, and most of them hopefully are retired already. And that would mean you might still be able to use your workforce up to 50 years old people in on-site working together with having mild symptoms and getting immunized. That is something that may have to be considered if we want to get out of this stalemate where everybody is staying home for an indefinite period, maybe up to 2 years or 3 years. So how do you plan for a pandemic? You have to look at all your key processes and now consider all of them that have a human, highly human element to it, working in close proximity. These are the ones that will be most at risk. How will they impact your key clients? We'll also consider all of your input, material input that are also human dependent for your suppliers. You have to take that into consideration. And you will have to be realistic because all of your typical recovery time objectives that you have in your plan, your business continuity plan, probably will have to be extended substantially. It's not business as usual. You cannot just use your strategies to recover from a fire or an accident. This is going to be a very long-lasting problem, not only impacted by the real epidemiology of this disease, but also by government actions. Some of the actions may be not in line with the science. We don't know yet. Maybe governments will overreact and keep people home for longer than required. And we should not blame them. I think it's a normal reaction because of the limitation of hospitals right now. But hopefully, as we get more informed data and specific information on who is affected, how does it spread within the young, within the middle-aged, within the older people, are we going to be able to devise a strategy where we can reintegrate part of the population in the workforce and work together again? So until we know more, I would say look at the criticality in terms of human dependency of your processes and your inputs and outputs, and try to serve as best as you can your priority clients. And all the things you can do remotely, hopefully you should be considering doing that as soon as possible.
So Ghislain, just one follow-up question to that. So from what I gather though, what you're saying or advising is that we also really focus on the way that the virus evolves and presents itself. And then we adjust the way that we as a business react as we get more information so that we tailor our response to the way the virus is interacting with us.
Yes, this is the scientific portion of it. We should learn from epidemiology and science studies on this. The other aspect we control less is the reaction of government and the restrictions. This is unfortunately something that any business does not have impact on, and maybe at some point, business associations may analyze the situation and propose different policies to governments, but I don't think we're there yet. And it has to be also, I think at some point we'll have to consider what we say risk appetite and tolerance. This is a very difficult subject, but at which point will we limit, you know, the activities of younger people, middle-aged people, to protect everybody and the hospitals? These are very, very difficult questions to answer, and they require, you know, discussions on risk tolerance.
Thank you so much, Ghislain. What I'd like to do now is ask Dylan regarding the challenges faced by organizations in developing and executing pandemic plans.
I think I'll start off by saying maybe a few months back, if you had asked me about pandemic planning and where that was in my priority of things to do, I would not have said it was a high priority. Maybe just a little bit of background, and this might help the listeners. My company was going through a process of enhancing its business continuity processes, and we did have a bullet point there, which was to look at pandemic planning. So I had a little bit of a lead time before this pandemic evolved to what it is now, and there were some ideas that were floating around. We had started drafting a pandemic plan, and immediately we were faced with a few challenges because, as Ghislain had said, no two pandemics are the same. You know, so it's very difficult to write a plan that's tailored to address all scenarios. So I guess one of the features that you'd probably want to have in your plan is, you know, stick to some broad principles, things that you know you'll need to address, proper crisis communication, you know, management of the safety and health of your employees, how you would go about doing that, and that will extend to altering your human resource processes. So remote working, are you enabled for that? And that then links in with IT. So these are challenges that need to be considered, and I guess the one takeaway for me in the whole experience was to have broad principles inside the plan. Don't have it be you know, too rigid, because you may end up with a plan that's not workable or practical given the specifics of the actual pandemic. And perhaps another one to get over, and I think this is with risk managers first, and then maybe with the leadership in the organization second, is to have this suspension, what I call suspension of disbelief. I don't think many of us would have predicted having experienced a situation like this. You know, of course, we've heard of H1N1, we've heard of SARS, and you know, many risk managers wouldn't have unless you were sort of based in Southeast Asia or the epicenters of these pandemics like Ebola. Many of us would have thought our organization, this is not a situation necessarily our organization will have to deal with. So having that mindset to begin with, when you write a plan, it almost becomes a little bit of an academic exercise, right? So I guess the thing is, you know, get over that very quickly. These things are real, treat it as a very real scenario, and when you develop the plan, you got to write the plan as if it's a plan you're going to execute. So that's been the learnings for me over the last couple of months when it comes to developing pandemic plans.
So in terms of the suspension of disbelief, what was the tipping point for you know, in general? Was it that you know, perhaps you can illuminate the you know,
okay,
the awareness process?
Okay, I think there were a couple of us in the organization who recognized that this was a real issue, and that was very early on in January. And it was for very different reasons. Me personally, I've got a relative who works in the UN within the United Nations. They get relatively good information, and you know, I asked him about it just sort of in a casual chat via a web chat, and you know, he brought home to me that this was a very real issue for others that shared the same concern. You know, they had personal experience. They knew people in China who, you know, at the time, China, the information wasn't very forthcoming, but they had personal connections through people that they knew in China, and this became sort of very real. So once we bought into it, we devised a way in which we needed to package this communication to management in such a way that, you know, look, we're not raising the alarm. We don't want to scaremonger, but there perhaps are things that we can do to prepare. It looks like we've got time. Things might get worse. We'll, like Ghislain said, stick to the facts. Be informed by the facts. Be informed by the authorities as best we can. But you know, if there are things that we can do now, we should. And we did. You know, we presented a case to management quite early on, possibly more than more than some of the other companies might have in the state of Qatar, and the reception wasn't warm. there was definitely a few naysayers, but I think we kept coming back. We kept bringing more evidence, more information, and you know, I think that brought them around.
Excellent.
One thing to consider also. One thing to consider in this case, this is not a situation typically faced by companies where they may be hit by one incident and other companies or, you know, organizations are not affected. Here, everyone is affected and sectors will be particularly hardly hit. So various governments in North America, I don't know if this will be the case in Qatar or in the region, will put in place financial aid packages for industries or specific companies. So this is something that you have to factor in also into your business planning, that there may be some help coming and you should be, you know, abreast of what is available to help companies survive, because some of them may unfortunately go bankrupt. We're taking major airlines here. Some are already on the verge of bankruptcy. And in the US, I know that's something that's being discussed, a bailout similar to the one that was provided to the auto industry during the 2008 financial crisis.
Guys, there are loads of questions coming in. Just to reflect on one of them, especially for Dylan. At what point would the organization announce this as a crisis? And to add to this, like, we've seen governments really reacting strongly, giving advice. At what point organization would go beyond this advice and ask for more? For example, in Qatar, authorities been asking for women, elderly people to work from home, but other business to continue as normal. But we've seen businesses that is actually taking more severe action than what the authority is recommending. So at what point the organization take this further and highlight it as a crisis beyond?
I think just, and this is just purely from our experience over the last couple of months, what is absolutely important is for every organization to establish what its position will be. Okay, so in the example of Q-Chem, inside of our pandemic plan, we specified criteria. It was based on a sister company's criteria that are based out in Singapore. Obviously, they've had experience with this before, so we had the benefit of you know, them sharing that knowledge with us. So what we went about and did was we defined, you know, a traffic light system: green, yellow, red, orange, red. Right inside the traffic light system, there's very objective criteria that say that describes the evolution of a pandemic. Okay, from early onset right through to your companies being fully impacted by it. And inside of the traffic light system, we personally, as a company, defined the steps that we will take. Now, it's always ideal, I think, if you can align that with what the country is doing and what the regulators and the industry are doing. But that's not always easy. As I mean, using the case of Italy as an example, you know, the country didn't take the problem seriously. So it would have been very difficult for companies to, you know, execute social isolation and other types of measures when it's out of sync with what the rest of the company or the country is doing. Nonetheless, I still think there's value in that. It gives management also a clear sense of what they need to do when certain trigger points are reached. So that's the methodology that Q-Chem has adopted. Obviously, we're very much in touch with our shareholders, and what the rest of the industry is doing, and we're working very closely with the Ministry of Public Health and the CDC to make sure that our responses, as a minimum, line up with that.
Thank you. Very clear.
Okay.
Now, I'll open this up as a general question. In terms of managing risk perception of individuals within an organization who are indifferent or appear to be indifferent to, let's say, strong words, or let's say strong indications that something really truly wrong is going on. How does one handle that? Who would like to take that?
Maybe I'll jump in, and then the rest of the panel can sort of add to what I'm saying. I think one of the things that I found very helpful was, once the company has established its position, is to use the full resources available within the company to go on a PR campaign, what some might call crisis communication. So in the case of Q-Chem, we immediately set up an intranet portal which specified all the information relating to the virus, but also importantly, it communicates the company position on it as it pertains to company processes and practices like HR or IT, for example. Using banners, and having those banners be prominently displayed at all the locations so staff can see it. Once a week, our CEO sends a message to the company just to give an update on the overall position. We have a dedicated email set up for specific alerts relating to the pandemic that goes out to the staff, so they know when they see this email, it's not just from HR, it's not just from IT, it's actually to do with the pandemic, and they should pay attention. And I think that really helps do two things. It helps pull the naysayers and maybe the people that are a bit indifferent closer to the company position, but it also has the additional benefit, I think, of giving people who may be a little bit panicked information about where the company stands that is informed by facts, not to allay their fears, but to say, hey, there's a way that we are dealing with this, and this is what we need from you to support that.
Yeah, I tend to find that the communication is key, obviously, but a lot of the time, organizations will do something and expect something from staff. This is what we're going to do. So now go out and execute that. And I think a lot of the times, especially in this kind of situation where you're getting a lot of information from social media, for example, which is great because you get a lot of information, but you also get a lot of fake news, you get a lot of false stories, you get a lot of rumors about, look, if you do this, you're going to cure yourself, the heat is going to cure it, and all of that kind of thing. So it's like, what's real and what's not? Now, if you see too much of that, you might think, well, our company is overreacting. You might get annoyed at your company for overreacting, and you're sending me home, and then I might not have a job to go to, and what's going to happen? So I think with the communication, it's especially important to explain the why. Why are we doing this? And I think, Dylan, you mentioned, how does it relate to our organization? Why are we doing this specifically? Well, guess what? We are a client-facing organization, unlike maybe other organizations. Therefore, we need to be in front of potential customers that now puts you at risk and your family at risk. And this is why we're making these changes to protect you and also safeguard the business and so forth. So I think the why is quite important. People need to understand why they're making these sacrifices or why the organization are making certain decisions. Otherwise, it's too easy to say, oh, they don't know what they're doing and they're overreacting.
Alex, 100% agree. And, if I can even add to that, the communication shouldn't be one directional. It should be two directional. So as an example of that, we developed a list of frequently asked questions, and each of the senior leadership team members then went onto the floor of where their staff worked and took an opportunity to explain the company position, and then also to hear the concerns and to hear the questions, and then in so doing provide the why as well, face to face. And I think that created a lot of goodwill and showed showed, I guess, the organization that, you know, we're not just reactive. We're taking proactive steps that hopefully will, you know, keep them safer.
And I would add that as in any situation in corporations, walk the talk is always very important, particularly in these situations. You know, senior management and the leadership of companies should lead by example. So if they advocate a certain behavior, a certain way of working, they should, you know, lead by example and do it as well, and not suppose that they are exempt from it and that everybody will do it. This is the most probably, you know, the easiest way to undermine any major initiative is when you don't walk the talk. So that's particularly important here. And also not to set unreasonable expectations. I think the authorities so far have reacted slow at first. Now, are they overreacting? We don't know. I think that seeing every country react the way they are doing is probably an indication that they have information we don't necessarily have as the public as to, you know, the tax this puts on hospitals, for instance. But you have to make reasonable claims. For instance, one public official yesterday said that we had to confine people home so that the spread would die quickly and we could go back to our daily activities quickly. Well, this is not realistic. Either you go mass immunization, take the risk, and then it will be over quickly, or you stay home and gradually immunize people, which will take years. You cannot have both. So it's very important for companies as well to set expectations and make statements that are credible, based on facts, and that also, you know, live to are in line with reason.
Agreed.
Guys, there's a lot of questions coming in, and I'm conscious of time, so I'm trying to bring a couple of the common themes questions. A lot of points been raised about home working and working from home. What is the risks associated with that, and what if the company cannot actually work from home? It's manufacturing or construction. What is the risk seen with these situations?
I would say that at this point, it may not be a matter for the company to decide depending in which country you are in. I don't know what the situation is in Qatar and other countries in the Gulf region. Here in North America and Europe, some countries day to day are imposing behavior to society that will limit what companies or organizations can do to be more resilient. So for instance, construction, any kind of activity that requires people on site, unless they are, you know, allowed by governments, maybe have to be stopped. And that's, of course, very concerning for those organizations. They may have to find ways to delay projects, focus on other activities that hadn't been planned at the time that now can be done without having human interaction on site. If you're not prevented from doing it, just, you know, take basic information available, look at the age of your workforce, find ways to, as much as possible, provide safe, you know, social distancing on the work site. Maybe buy protective gear if this is impossible for you to not work from safe distance, and monitor the situation as you go along. As soon as you see manifestations of infection happening on site, adjust your working, you know, modus operandi accordingly. This is going to be a situation where you have to go. You could go step by step, continue certain operations, and monitor the situation very closely and adapt. Maybe stop, reflect, analyze, and then try again. And of course, you may face situations where workers will not want to do that anymore. Some of them, to the contrary, will say, I want to work. I'd rather work than stay home. So it's a mix of constraints, some of them from society, some of them from human behavior of workers, and some of them from government authorities imposing restrictions.
And this will be a very dynamic day-to-day changing situation that will have to be analyzed all the time.
Yeah, and for example, I look at shift work, for example. If you're an oil company, for example, and you might have shift work, you might be in a remote location and you might have 500, 600, 700 people working on a site. There's various ways of approaching this. I know some who would, for example, extend the shift and keep people working. So they're all quarantined essentially on the site. They're working longer number of days. So instead of 4 weeks before changing their shift, they might work an additional 2 weeks to make sure everyone is healthy. Those who maybe do show symptoms would be quarantined separately, but work can still go on. Obviously, this is based on critical staff. You would want to cut your staff to a critical number of people and keep the other on shift as well, just not working. But separately, just in case anyone does fall ill, you can always change the shifts around. So there's ways that are creative to get around these things if it's going to cost too much to just stop all activity altogether, if you can do so. Automation, obviously, of some operations. And at the end of the day, it goes back to your, for example, business continuity plans of how much is acceptable? What's your acceptable level of production or service or quality or whatever it is that you can get away with during a crisis like this? In the UK, I've spoken to a few companies that are, for example, they've sent people home to work from home, but they know there are critical staff that must work in the office. So what they've done is they've spread the office right around. Now that they've made space by sending people home, they now have spread the office so that you are a minimum of 2-3 meters apart at the desk. You're not allowed to get any food from the canteen. That's been closed. You have to bring food with you. You eat at your desk. You don't sort of mingle. You keep your safe distance. You do your work. They've shortened the day a little bit, and then you go home. Gyms are all closed. In fact, they've also sent out policy saying do not go to the gym, do not mix with others, and so forth. And we talk about what if you can't stop? It might be a legal requirement to continue if you're a hospital, for example. So it's not just what if you have to stop, what if you have to continue? How are we going to deal with all of these things? And again, sometimes it might be in a hospital situation, we know people are going to get sick. We know our staff are going to get sick. How can we quickly deal with that to avoid a knock-on effect?
And I absolutely agree with you, Alexander. And I would add that given that contagion happens at the earliest symptoms, as soon as somebody feels a sore throat, for example, companies may be advantaged if they provide assurance to employees that they will not be penalized for revealing that they're sick, that they feel a symptom. This would, create openness to reveal and limit the spread of such a problem in the office or on the work site by assuring that they will not be penalized, they will be taken care of while they recover from this, and that we encourage every employee to, as soon as they feel a symptom, to report it and go home, basically.
Sorry. It also goes back to what I had initially said about planning in advance for these kind of scenarios. Again, if you're a manufacturing company, if you are developing something, look at the Rolls-Royce example. Do we have something alternative we can do that fits in with the current pandemic that means that we can actually continue our business somehow, maybe even get support from the government? Or or maybe we haven't thought about working from home before. Maybe that's something we need to look at. Do we change our whole business model? Is there something new we can do that doesn't require us to maybe run the plant? Maybe we can do some other stuff. Maybe that's the whole digital transformation that everyone's concerned about. A lot of people are doing digital transformation just because we need to do digital transformation because everyone is. What if you actually did digital transformation to become more resilient to things like this? Again, not every industry is going to be able to do that. But if you are a traditional manufacturing business, why don't you diversify a bit so that if you ever have to shut down your plants, you can still do this? It's about the longer term thinking, the more strategic thinking, and the horizon scanning and doing all of these kind of things to try to make sure that risk is supporting your objectives. Can risk help you in setting your strategy, inform your strategy, drive your strategy going forward?
Now, Hatem, there's we've got about, I think, 15 minutes left. Is that correct?
We do have 15 minutes, and there is loads of questions not answered yet.
Will we
Exactly.
be staying on to answer the questions, or is it a hard cutoff?
I think we can go on for a little bit longer. I just want to make sure that everybody who spared the time are able to collect as much as possible. So let's try to stick to the time, but of course we have flexibility since we are a webinar and we don't have to leave the room.
In that case, Hatem, what I'd like you to do is maybe read or choose one or two questions and just pose it to the panel for answering. What do you think?
Yes.
Well, so
yes.
One of the questions that's been asked a lot here is we still didn't see this coming. We still didn't see a lot of other risks coming. How and this is question has been asked even before this pandemic and before COVID. Like, how can we make sure that we see these risks, these emerging risks, these very low probability kind of risks? What can we learn from this? The question is, Ghislain, is like we kind of risk managers could not see this risk coming, like many other very low probability risks. How can we predict these and manage this in the future?
I would answer that two ways. One is, scanning the horizon and having people brainstorm about risk to, analyze any potential emerging risk. But one thing that comes to mind right away is the approach to business continuity. As I mentioned earlier, business continuity is supposed to handle any kind of situation. Of course, certain risks will impact you differently, and particularly in terms of recovery time objectives. So one thing you might want to do is in the future, instead of trying to look at specific risks that may happen to that will impact your business continuity, think about the nature of the risk. For instance, take a pandemic. Its characteristic is that it affects everybody, not just your own operation. So you might say, I don't know what risk might occur that I haven't foreseen already, but what if it's a risk that affects every organization in the world or every organization in my sector or in my region? How would that affect my business continuity plan? And have a version of your continuity strategies that takes that into account. Then you might think of the characteristics more generalized of another specific risk you have taken into account in your plan, and generalize it. Say, what if something else than this specific risk happens, but would have the same basic characteristics in terms of spread, in terms of depth and range and duration. Duration, of course, is a major one, because all of the approach to business continuity is recovering up to a certain point of service within a certain time. What if you cannot do it for whatever reason? What are the scenarios? So those would be my advice.
As if to maybe just, sorry, just a small thing to just add to what Ghislain had said. I've been talking to a few companies. We're all trying to sort of learn and share experience through this new ground that everybody's breaking, and definitely the ones that are up to speed, the ones that seem to be coping a bit better. And I know it's still early days, and this is going to be with us for a while, but this is just anecdotally from what I've observed. They are the ones that have more robust business continuity planning processes. The ones that don't, have been caught a little bit more flat-footed and have had to do a little bit more time, spend more time trying to come up with solutions. So, anecdotally, exactly what you said, Ghislain, I've seen so far.
Yeah.
Yes, we often forget. Go ahead, Alexander.
Yeah, no, I just wanted to follow up on what you had said, Ghislain, about trying not to think about the specific risk, because if we take the scenario right now, in Europe or America to Europe, flights are essentially grounded. Okay. Now you might say, well, we couldn't have seen that happening. But I remember a few years ago when the volcano in Iceland happened, everyone said, oh, we couldn't have foreseen the volcano erupting, and basically it meant all the flights were grounded. And then think back further. I remember a time when some buildings went down, 9/11, and all flights were grounded. Oh, we couldn't have foreseen the Twin Towers being attacked like that. Okay, so let's not look at that. We know that flights have been grounded in the past. We know that if I'm in, I used to work in Iraq. If I'm in Iraq and flights are grounded, it means I can't get staff to and fro. I can't get critical equipment back and forth. So it doesn't matter why flights were grounded. I just knew that flights were a critical part of my business and we needed them. And if they get grounded for whatever reason, volcano, terrorism, pandemic, I need to be ready. I need to have alternatives. Car companies, car manufacturers, they use the ground. They used, well, some of them use the road transportation system to get equipment back and forth through Europe. I was traveling with Emirates a lot, and in fact, Qatar Airways as well. They're very good at dealing with their customers when something occurs. When there is bad, harsh winter weather and all flights are cancelled, they put you up in a hotel, everyone's happy. Meanwhile, you look around the airport and everyone's stuck in the airport being dealt with badly by their flights, and it builds a certain brand. Something that's very positive I want to just highlight in Qatar, and it's probably due to circumstances, but they are very forward thinking now when it comes to business continuity. I think a lot of organizations are putting together their plans. The government are doing a fantastic job of organizing events, scenario events, where they bring different organizations from the country together to work on these scenarios. And maybe Dylan, do you want to just share a bit? Because I know this is a Qatar Regional Group, and I know that most of the people viewing from Qatar will be aware of this, but we've got 100 people, and this is going up on the website as well. It might be interesting to share what it is that happens in these kind of events, just for the rest of the viewers internationally.
So are you referring to the annual cyber drill that we do, where all the industry get together? We basically do a live fire desktop drill where all the companies get given scenarios, and really what that does is you come to this event with your business continuity plan, your crisis management plan, and you have an opportunity to test it in a scenario. You submit your responses to different injects, and then at the end of that you get a report, and they give you feedback on what they think worked well, where there are potentially areas for you to improve. So just going through that experience does sensitize one to how one might have to how you might have to react in a crisis type situation. You also get to use these documents that maybe for some companies it's just an academic exercise. So you get to you get to test it in a sort of simulation, and that's really good. But on top of that, you also get to interact with peers in industry, and just by meeting these people and talking about the event, there's a lot of knowledge sharing. Certainly, I mean, I think South Africa's got where I'm from, has got a very advanced risk management mindset within the country and the companies that work there. But I've not experienced the kind of cross collaboration like I have since I've been in Qatar. It's really something, and I think the companies do benefit from that over here.
Yeah, and I think that's what we should be seeing a bit more of: government organized events where companies can come together, or company organized events, sector organized events. But I just love the fact that it's across the country, and you select the organizations coming together and being able to do this, learn from each other.
Sure.
I just think it's a great exercise and learning process.
Sorry, and I also just have to say this. I have to give Qatar Petroleum some credit as well. They host a quarterly business continuity forum for companies within the industry, and it's really, I'd be remiss if I didn't say that. They really do act as a good coordinator and disseminator of good practice when it comes to business continuity, organizational resilience.
Thanks, Dylan. Thank you, guys. Another question actually for the whole panel this time. What would be the advice for business continuity coordinators who are experiencing this pandemic for the first time?
I would say you're not alone. The last one was 2009, so unless you were around and active at that period, the likelihood is that this is your first time, and many are in your shoes are actually. So it's new for most people, and I would say if you already have a business plan, a business continuity plan, again, just modify it according to what we just discussed during this panel. One thing I would also mention is maybe it's time to move from planning to management. Since France has referred to this as a war against the virus, I don't remember which general during World War II who said the plan is nothing, planning is everything. As circumstances change, you have to adjust. And we sometimes forget that business continuity is also a management approach. The Business Continuity Institute puts forward that it's business continuity management, the result of which is a plan, but you have to manage it. And when the culture of business continuity management is well implemented in the company, you are more adaptable to situations. So I would say follow the situation closely, look at the implications on your operations, as I said, focusing on the human element, and you will do as well as anybody else, because no one has lived through such pandemics many times. The last one was SARS in 2005, which was not as bad as this one, and then you go back to other decades before.
What I find interesting about this is, it's interesting because when we look at the pandemic itself, the virus itself, the risks from the virus are, I think, Ghislain, in your presentation mentioned you can get sick. Yep, you can potentially die if you have underlying issues or if you're elderly. So we know that, okay, that's one impact. From an organization point of view, business meetings could be canceled, training could be canceled, percentage of the workforce may be unavailable, our supply chain may face some challenges, and then it might escalate to a loss of workforce, major contractors not being able to come to site. You had mentioned legal challenges, projects might get delayed, and it can escalate. One thing that's a bit different as well, though, is what's the impact of how countries are actually handling this? The virus isn't the thing that's causing the most pressure for organizations. It's the government's decisions now. So now the governments are shutting down this, they're shutting down that. People aren't allowed to go to work. It's forcing organizations, and it's not just organizations. I mean, of course, we look at companies, and that we're looking at it selfishly from how do we survive. But what about students who aren't getting their education, and maybe they have huge student loans, and maybe they can't afford to live in their accommodation? And we've got the school closures, and of course, nurses. 35% of all nurses have children. So how's that going to impact as well? And the economy crashing means loss of jobs. British Airways are going to be announcing job cuts. I think British Airways, Norwegian are. A few of the big airlines, Flybe went bust already. Another retailer has gone bust in the UK, and this is early days. So I think one thing is that to take away from this as well is objectives. What are objectives? So organizationally, what are our objectives, and how do we meet those objectives? As a society, what are our objectives as well? Yes, we need to look after the vulnerable. What about the economy? What about our students? What about everything, and looking at it as a whole? We accept, I got an interesting statistic. I was having a conversation with someone just before this. We accept quite a lot. We accept a lot of health and safety related deaths every day in order for the economy to continue and for infrastructure to continue to be built. We accept this. And it's massive, it's huge. Now we have to look at this as well. Should we be, looking at things differently? So it goes back to, I think, Ghislain's last slide in terms of the scale of where things are. There's no right or wrong answer. It's just something that we do need to consider. In other areas of society, we're happy to let people, die, and it's not acceptable. We need to reconsider all of these things. And maybe this new shift, I think, Hatem, at the start, you said from this, we might see more people working from home. We'll see a different view on society, a different view on how we do business. And maybe it's for the positive. Maybe we start treating other terrible things that go on in the same light, and we try to treat those as well.
So Alex, excellent points.
Sorry,
excellent point, Alex. I just had a client calling me today, and he said we didn't have business continuity plan, and the government closed access to our buildings because they identified the area to be like a riskier area. So now we need our business continuity plan, not for pandemic, but actually for lack of access to the building and due to other scenarios. So back to Ghislain's point, business continuity plan is really important regardless of the scenarios. I was actually going to take this to a question to you, Dylan, because you mentioned at the beginning that you are in the middle of developing your business continuity plans, and you are currently now in the middle of that process. How would it have helped you, or how it does help you now, doing all of these crisis management and managing the situation to handle a scenario that was not predicted like this pandemic? How does the BCM help you in this situation?
Okay, firstly, let me just say I wish the pandemic had come in 6 months' time. I think we would have been a little bit more comfortable than we are now, but unfortunately, you know, that's not the case. Look, I think, and Ghislain said that, right? The plan is nothing, but planning is everything, right? And I think just by going through the process of planning, there's immense benefit in that, and it's certainly better than having no plan. And I think maybe, hopefully, I've answered your question. As a business continuity professional, as someone who's involved with our crisis management team, as an IRM manager, this is an exciting time. I think as much as on the personal side of things, I'm distressed. I'm distressed for family. I'm distressed for friends, and I'm distressed not only for health and safety, but you know how the global economy will impact the lives of people I know. I'm very distressed about that. But professionally, this is perhaps a once in a lifetime experience. I think someone asked earlier on, you know, what advice would I give or thoughts would I share with business continuity professionals? Is make the most of this. You're gonna, you know, get as involved in this within your organization as you possibly can, because you are going to learn a heck of a lot as a professional. And don't be afraid to make mistakes. And I think, you know, if there are managers and senior leaders listening to this, I would also say, you know, everybody's doing the best they can, and we're not going to get it right off the cuff. We are going to make mistakes, but you know, everybody allow that to happen, because that's how we will improve.
Thank you, Dylan. Thank you so much, guys. We're running out of time, so I'm going to go through the last 2 questions here. There was a lot of other questions. I'm sorry for all of the people who asked that I could not go through the questions. Mainly for the question we're going to go through is for the medium small size organization, what they are supposed to do in such scenarios where they already don't have many employees, they have limited number of employees, and having half of them working from home or not working is impacting them. Any advice for the small medium organizations who have limited staff already?
I mean, it depends on what aspects. I mean, for example, if it's from a cash flow point of view, because maybe they have to, you know, really limit their business. I believe that a lot of banks at the moment are looking to lend. So whether that's an extensive overdraft limit or getting a loan to at least get through the tough times, that might be an option. It depends. I think one thing that's very important, I went to visit an organization once, and it was quite a small organization, and I asked the board, I said, do you have a risk manager? And they said, we thought about it, but if we had a risk manager, it would be probably pushing the responsibility for risk away from ourselves. And at the end of the day, we're the board and the buck stops with us, and therefore we are also the risk managers or the chief risk officers. So we should be thinking about risk with everything we do. So for even smaller businesses than that, the smaller you are, probably the more important risk management is, because you want to be taking risks, but also when certain situations occur, you're most at risk. So I think for organizations that don't have a risk management department, don't have risk managers, maybe try to educate yourself on what risk management is, how it should feed into objectives, how it should feed into strategy, and how it should always be prepared for the worst. I think, Dylan, you made a great comment there. If only it was 6 months later. I think everybody is thinking exactly that. But I bet you in 6 months' time, we'd be saying the same thing again. Nothing ever seems to come at the right time.
Absolutely.
But I think the smaller we are, I think the more nimble we can be as well. We can change our business models. We can, find new ways of selling or change our products or services. And we need to just look for opportunity in those situations. But yeah, I think risk management is very useful for everyone. And it's not a matter of listing out all your risks, having a risk register, and then reviewing them, making it all formalized. It's just making sure that with every decision you make, you're using a risk-based approach to making those decisions.
Very good. Thank you.
And it
Alex.
depends a lot on your industry and what you're doing. But try to think: is there a way I can transform my offering from a service based on human interaction, to something that doesn't require it as much or not at all? I'll give you a very specific example. Here in Montreal, we have an international festival of the film on the arts. It's the biggest in the world, but it's a small festival. So it's a small organization. And due to restrictions, they had to cancel their festival, which was to start today, actually. And you would have thought that that's the end of it, but they decided to make it an entirely online event. So they went back to rights holders of the movie, the producers, the production companies, and they negotiated that some of their movies would be available online for a limited time and for a fee. And that way they were able to maintain staff, being paid during this difficult time. So it was not an entire loss. So if you are in a business that may seem that has no future given the situation, try to find how you could deliver your service differently and still go through it. And again, watch closely at the statistics. If trends continue and people below 50 are not that much impacted by the flu, there may be a chance to get those people to work on site together and try to limit the interaction with the most at-risk people. Again, a risk-based approach is what we always advocate in the risk profession. We should try to find ways to protect the people most at risk while providing for the other parts of the economy to continue working. That I think we have to watch at that, of course, being very, very careful not to hurt anyone as much as we can. But as Alexander said, we don't think twice about taking our car every day to go to work. And there's lots of accidents and deaths related to motor vehicles. We have accepted that. We have accepted that airlines crash, that trains derail, and there are accidents everywhere. But suddenly we are very, very concerned with this and seem to want to go to risk zero on this one. Maybe we'll take a step back and say what is really acceptable here, considering all the implications this risk has on society.
Can I ask a question? Can I ask a question, Ghislain, in your presentation, and also we've touched on it with some of our answers, but we've not actually led into it. You mentioned key risk indicators in your presentation, but also I think a few of us have been talking about, tracking signs and so forth. Can you give some examples or discuss a little bit more about the key risk indicators, the kind of key risk indicators we might be looking for and so forth?
Yes, during the H1N1 pandemic, as you saw the chart that I showed, there was a cyclicality to it, similar to the natural annual influenza risk. And it was not a kind of outbreak that risked going up exponentially or very close to it. But the risk indicator that was used was to try to forecast potential absenteeism, because the business continuity plans had a number of scenarios. As I mentioned, one was 20% absenteeism for 8 weeks, a worst case scenario of 40% with a peak at 50 for 1 or 2 weeks. So it was very important to see that coming. And one of the leading risk indicators for a specific enterprise was to look at the generalized data coming from hospitalization that would kind of serve as a proxy for forecasting absenteeism. So in this case, maybe what's more relevant here is the statistics on impacts on people's health based on their age. I think that will be critical. As I said, if it's confirmed more and more that people under 50 are basically unaffected by this, or very mildly, except if they have an underlying health condition, you could start adapting your workforce to that situation by asking people. You don't want to force people to work or take undue risk, but you could say, are there people who have the profile that fits a healthy ability to work with limited risk, and do you want to work? Because some people want to work. They don't want to stay home and risk losing their revenue. These will be very difficult discussions to have, and with lots of implications, including moral implications. And you know, we have to take into account health conditions, but also the attitude to risk of our employees, of our stakeholders, and of society in general. Yeah. But key risk indicators will clearly be linked to not only the spread of the virus, because we know this is a big risk, but the spread of the virus is one thing, but the impact it has on different segments of the population also.
Yeah, thanks, Ghislain. Actually, I think been asked a lot, guys, about small companies and what they should do. I genuinely believe that agile companies that is very able to adapt quickly and will survive this, will actually be very fortunate in the future. Other companies who will not be able to respond, change their model, as Ghislain said, and make it online, change their business model and manage the situation, will just disappear. And the survival for the fittest, and who will survive will actually be very fortunate. Guys, conscious of the time, we've discussed a lot of things, and there is a lot of key knowledge that I've learned from all of the panelists here. I would like to allow all of the panelists to just give a final key takeaway from the panel, from the discussion with the other panelists. What is your key takeaway and knowledge from this panel that you'd like to irritate on the attendees? I'm very happy that we have most of our attendees still here and resilient and didn't want to leave the call, reflecting the amount of benefit they are getting. But please, if I can start with you, Dylan, what is your key takeaway from this panel? What's your key, what you will do differently from taking away from this panel?
Yeah, I think if I can, you know, my parting thought will be, you know, that this pandemic is not going away anytime soon. You know, so in your pandemic planning activities, have a medium-term mindset in whatever it is that you're going to be doing. I think we will adjust over time, as Ghislain has said. You know, maybe before a vaccine is developed, we may already be adjusting our risk appetites from where we are now. But nonetheless, just take a medium-term view in whatever it is that you are going to be undertaking going forward.
Thank you, John. Alex, what would be your key takeaways?
Right. Well, a couple of things. I mean, technology is one thing that we've not really talked about, but should we be looking at technology? Should we be looking at, you know, the opportunities of technology? In the same time, I say that we obviously know that, for example, Microsoft Teams really struggled recently with everyone working from home, and they actually crashed and was unavailable. But I'm sure that's just a temporary thing, and going forward, things will improve. And that's during the crisis. But from that perspective, I think, yes, let's survive, but let's also look at opportunity here. A lot of organizations can find opportunity, maybe not financially. Maybe it's not, oh, we found a new product. Maybe it's not, oh, we're going to make more money because now we can sell X, Y, Z because we're pharmaceuticals or because we're hospital services or whatever. But it might be from a reputation point of view. Do we look at doing the right thing? Is there anything we can do in society to do the right thing? Richard Branson has written in the past in one of his books about circles. I think it was circles, where first start in your family. You do all the right things in your family. Then you can extend it to your street. Do something good for the street. If everyone can do something good for the street, everything's going to be better. Let's expand that to our little town or village. And then let's expand it to our city, our country, and hopefully one day we get to the whole world. Well, as an organization, should we be looking at what we can do locally to improve the lives of people or to help in these cases? It's going to improve the reputation for sure. And that's an opportunity in itself. So it might not be financial, it could be from that point of view. And at the end of the day, communication is key as well. Taking the right communication, avoiding all the fake news items, and trying to pass on the correct information to your workforce, communicating back and forth, as Dylan correctly said. Let them have their say.
Thanks, Alex. Arn, what is your key takeaway?
Actually, it goes back to a point that Ghislain made earlier about how we have to be observant on the progress of this virus, and then how we change our risk appetite accordingly, how we work accordingly, and how we take a risk-based approach in order to, one, meet our objectives whilst keeping our employees safe, as well as our customers, as well as our other stakeholders. That really is a big thing for me, because I work in a free zone. I'm the corporate planning manager there, and we, as soon as we heard about the virus, for dumbfounding the Chinese Communist Party, we instituted an immediate travel ban to China, because we didn't want to risk our people's health. So, but now, as time has gone on, clearly the travel ban is on, but we adjusted it the more that we learned. We once we heard that it was transmitted through unwashed hands, we gave everybody hand sanitizer. So for me, it really underscores that point.
Thanks, Arn. Very good point. Ghislain, your key takeaway.
Yes. I would say, again, we have to monitor the situation closely. I understand fully that governments have shut down their entire countries, not for out of a whim. It's because I'm sure the infrastructure of hospitals requires it. And once this will have been under control, we'll have to, and everybody will have been confined home, we'll have more time to think and analyze the situation and think about what we want for the future. Are we going to stay home for 2, 3, 4 years until everybody is immunized? Is this virus going to change every year so that we live in this situation for potentially decades? If so, is this an opportunity to reconsider the way we work and work from home as much as we can, which would also help manage the risks to the planet due to climate change by reducing 30% of emissions due to transportation, personal transportation? That's maybe something to consider. And finally, I would hate myself if I did not mention the extraordinary devotion of healthcare workers, nurses, doctors, all the people who work in hospitals, who put their lives at risk every day, taking care of people. And that's also why we have to, when we talk about risk tolerance, not think only about companies, employees of different sectors, but think that our decisions and our actions may eventually impact how healthcare workers will be exposed to this risk in hospitals. So we have to take all of that into consideration. These are not only risk issues, but moral issues. So we have to be very careful. But I think we'll have to think about what kind of tolerance and acceptance of risk we are in, and what is the right balance between protecting everyone versus continuing to work and develop ourselves as also professionals. As Alexander said, the education of younger people and realization of personal objectives. So for companies, it's going to be very hard. For some of them, it's almost impossible to avoid business interruption unless they can find a way to deliver their services differently or convert themselves to other services or products that are more in need in these times. I would see, if this is going to last for many, many years, robotics being a certain opportunity. If we cannot work together anymore in plants, maybe we'll have to develop robots that can do it for ourselves.
Thank you so much.
Add a final point to that? It could be that our society or economy is not geared up for this new reality. And maybe it's time to look at a whole new structure of economy or the society. I've seen different variants. One is called the circular economy, quite fascinating to read up about and listen about. But you're right, Ghislain, if this is a long-lasting thing, we might have to look at how we do business in the future and even how our economy is geared up.
Absolutely. Guys, I cannot thank you enough. There's a lot of key takeaways that I've taken myself. The good news is the webinar is providing us with additional feature of recording. So hopefully we'll be able to reconcile this and write a write-up to make sure that all of these amazing points raised by our panelists is going to be shared. Just to remind all of the attendees who are still resilient with us 20 minutes past the event, we will be sharing the slides that Ghislain took us through the IRM website. It's really thanks to all of our panelists, Dylan, Alex, Arn, and Ghislain. You've been really very informative and you've shared a lot of information. Thanks to all of our attendees, thanks to all of the questions that came. I've started already receiving a lot of feedback from the people thanking the panelists and the information. Also thanking IRM Global, who actually supported our chapter in Qatar by this good webinar tool. And I can promise you all that going forward, there will be more of these webinars, allowing more people to attend and more people to take the knowledge, not only from the region of Qatar, but for more global. Guys, I cannot thank you all enough again, and hopefully leave you with enough time in the evening to go and spend more time with the family, use technology for FaceTiming and connecting with them. Stay all safe. Thank you so very much, and hopefully we'll see you again in future webinars and seminars. Thank you.
And thank you, Hatem. Thank you very much for driving this.
Thank you, gentlemen.
Thank you,
guys.
And the technology worked.
Yes.
Yes.
Thank you.
Way of the future.
Yeah.
Bye-bye.
Bye.
Have a nice
Thank
evening.
you. Bye.